The Pediatric Diversity and Inclusion Council, the PDIC, was founded in 2013 to provide a supportive environment for residents underrepresented in medicine as they navigated their training and to serve as a resource for career guidance with a focus on professional and personal growth. Over the past 7 years, the PDIC has undergone tremendous growth. We have broadened the department's focus from recruiting a diverse house staff to providing structured diversity and inclusion programming as core elements of our pediatrics residency training experience.
The PDIC was started to provide infrastructure and support for our residents who are underrepresented in medicine. This became even more evident during COVID-19, where we saw the health inequities in our patients and in our communities, and also the pandemic of racial injustice that was highlighted during this time. This really brought our PDIC together so that we were not just doing the work alone, but we're doing it together, supporting each other, and not burdening just our residents who were underrepresented in medicine, but together with allies to be able to serve our patients better and to also serve each other and support each other better.
As the only Black man in the room, countless times throughout my scholarly and now professional career, diversity has always been incredibly important to me. I grew up in a very diverse city in Northern Virginia. However, despite the fact that my inner circle was quite diverse, I was always struck by the homogeneity of the classrooms that I was in. Diversity isn't just about creating more seats at the table. Diversity is about building a new table that everyone can feel comfortable and excited to sit and speak up at. I've been incredibly excited and motivated by the work that my colleagues have done thus far towards building the diversity and inclusivity of our program.
As a Black woman in medicine and first-generation college and medical student, diversity and inclusion have always been of utmost importance to me. I'm proud to train in a residency program that prioritizes the recruitment of a diverse workforce and openly discusses the impact of systemic racism on health disparities.
Growing up in suburban and rural North Florida, I was often presented with one example of what a doctor looks like: straight, white, and male. Throughout my medical education, I've been so lucky to have that one example challenged, which has enriched my understanding of the world and my ability to care for diverse patients.
My name is Jackie Outlaw, and I've been working with the Diversity and Inclusion Council since the onset. We are a product of our experiences. My commitment to diversity and inclusion initiatives is stronger than ever. Working with people from various backgrounds and helping progress the mission of the council brings out the best in me. And I look forward to more experiences in the future in working with the Diversity and Inclusion Council.
As a physician, I feel that diversity in medicine is crucial in providing patient-centered care. A more open-minded and culturally sensitive staff can better meet the needs of our diverse patient population. This council has allowed me to participate in a variety of educational sessions, both as a resident and at a departmental level, about diversity in medicine, and has led me to build a network of residents, faculty, and staff who have similar interests in increasing the diversity of our institution. I've really seen this council grow in my short time as a resident here.
Hi, I'm Dr. Patrice Pryce, and I'm one of the critical care fellows at Morgan Stanley Children's Hospital. I also serve as the fellow liaison in the Pediatric Diversity and Inclusion Council. Ensuring diversity and inclusion in medicine has always been a passion of mine. As the daughter of Jamaican immigrants and as a Black female physician, I have a firsthand understanding of its importance in society and medicine. Throughout my career, I've remained dedicated to transforming clinical training and empowering those underrepresented and allies to address the environmental and social factors that influence the health of populations disproportionately affected by diseases and policies.
Our overarching objective is to expand our efforts to a national level and for our program to be recognized as a hub for diversity training in research and patient care.
The Pediatric Diversity and Inclusion Council aims to highlight the experiences, amplify the voices, and champion the inclusion of those who have historically not only been marginalized in society, but also in medicine. Through a focus on intersectionality, we are further able to understand the perspectives of our diversifying patient population as well.
One of the things that my colleagues and I felt was most important after a lot of the tragedies that we've seen in the community was to come together as a group and to work with both our attendings, our program leadership, and our department leadership. We've been supported at every level. And honestly, words mean a little bit, but actions speak words. And the actions that we've taken thus far have been incredibly inspiring. Throughout the past few months, as we've gone through a hard time, has definitely made the hard time a little bit easier. And I honestly can't say that there's any place better to be during a time like this with the things that we're going through.
I can attest that Morgan Stanley Children's Hospital values its anti-racist credo and inclusivity. I am proud to be a part of this institution and to help improve upon a foundation that is dedicated to combating racism and bias in medicine.
In the midst of one of the most diverse and inclusive cities in the world, we serve all with the utmost in dignity, respect, and gentleness. We strive to push the boundaries of inclusion, representation, and equality among our faculty, staff, and training programs. We are committed to eradicating bias and embracing anti-racist practices. Importantly, we are committed to reflecting the diverse populations we diagnose, study, treat, and heal. We invite you to be part of our present and our future, and to join us in this essential, ongoing journey.
The Pediatric Diversity and Inclusion Council was created to address this need while celebrating and supporting the unique and varied people who make up the Department of Pediatrics. Our residents and faculty are promoting initiatives both in the hospital and the community to encourage people from all backgrounds to learn from one another and share in an environment of mutual respect. We are passionate about this work, and we invite you to join us as we continue to work towards improving the lives of our colleagues and our patients alike.